Good afternoon, everyone, and welcome to the Board of Pharmacy's webinar today. Our topic is going to be Pharmacist Administrations. I'm Tom Glinsky, Chief Inspector with the Board. With me today is Lisa Thompson. Lisa is our inspector in the Southwest Missouri area, Springfield and Joplin area. So welcome today, Lisa.
Thank you. Hello.
Before we get started, I'll go over just some general information about our webinars. You're in listen-only mode. You cannot ask a question verbally. If you have any issues with the audio over the internet, there is an option to switch to telephone mode on your toolbar. You will get an hour of CE for this program. You must be officially signed up and logged in on your computer. You will not get credit if you're just listening over the phone. You must also be logged in on the GoToMeeting website. If you have more than one person in a room listening, only the person who's actually logged in will get CE. There's a survey at the end that you must complete. If you don't get it automatically, we'll email it to you, but you must have it back to us within 48 hours. And we'll go over instructions again for CE at the end of the webinar. CE is not submitted to the CPE monitor. People always ask, why don't you submit it? The reason is the CPE monitor currently does not have a method for non-ACPE providers to submit CE. They are working on that, and we hope in the future we will be able to submit to the monitor. We have handouts on the board's website. If you go to our home page, scroll down to the section on where it talks about the webinars, and there'll be a link about this webinar. There'll be a link to the handouts. We do a recording of the webinars. We post them in about 14 days. It's a YouTube video. We now have a special section on our website listing all of our webinars. And you do not get CE for watching the recordings. We will, time permitting, take questions at the end of the program. If you would like to submit a question during the program, go to your toolbar and just type it in and hit send. Again, we'll take those at the end of the program. So we'll get started today talking about a pharmacist administration and immunizations. We're going to review the regulation requirements and then explain some of the statutory changes that happened this year regarding this. I have the webinar kind of divided into these sections. We'll briefly talk about the statutes and regulations, the statutory changes, and then I'll talk about the general requirements of administration, and then we'll go into the specifics of doing it by protocol or by prescription order. We'll talk about off-site administration sites, and then we'll go over common deficiencies and take questions at the end. The one statute that gives the pharmacist the authority to administer is 338-0100. That's the practice of pharmacy. And then there's three separate regulations that cover the different types, the two types of administration, and then there's one talking about non-dispensing activities that lets you go off-site. All these can be found on the board's website. Statutory changes this year. This legislative session, there was a Senate Bill 808 that revised the administration statute 338-010. And the main part of it, it added these 5 vaccines to the ones pharmacists are able to give by protocol. So it added hepatitis A and B, diphtheria, tetanus, and pertussis, and it also includes combinations of those. So like a Tdap, it would be covered and you'd be allowed to do it by protocol. The changes to the statutes made by Senate Bill 808 have not been added to the official statutes on the Secretary of State's website. On our website, we have a link directly to the Senate bill if you want to see it actually, the full text. Besides adding those 5 vaccines, the statute did add some requirements for pharmacists administering vaccines. And some of these are kind of repeats of what we had in the rule, and then some are new requirements. The first one is required that pharmacists administer vaccines in accordance to CDC guidelines. This differs from what the current rule says. Our rule says you're in compliance with CDC and the manufacturer. Well, this statute would trump our rule, and after consulting with our legal counsel, it has been determined that this applies to all vaccines regardless of the method they were administered. So it applies to both protocol and by prescription order. So the effect this has is if you're doing a vaccine and the CDC has a stricter guideline for that vaccine, you must follow that. An example is the herpes zoster, the Zostavax. CDC says age 60, the manufacturer says age 50. Pharmacists have to abide by CDC guidelines, and that applies by protocol and by prescription order. So in Missouri, currently, pharmacists can only give Zostavax to patients age 60 and above. The board at the meeting this week will be talking about trying to fix that and get back to where we were with allowing any age by medical prescription order. Statutory also requires that the patient remain a safe amount of time in the pharmacy. Our rule already had that, and also required emergency treatment protocols. Our rule already required that to be part of a protocol. Statute change also added pharmacists that need additional training. Our rule already required that. However, the section in red is something new. It requires that you receive a certificate from the board upon completion of such training, and you display this certificate. The board never issued any kind of certificates. What we had was the notice of intent forms, and we were posting that online as a way to know it. So what the board did was on the online licensee search, if you search your name and you do have a notice of intent filed with us, it will now show up at the bottom here. And so this is what the board is considering the certificate we're issuing. At the board meeting this week, we're asking the board what needs to be posted. Will you actually have to print this, or will going online and just being able to pull it up suffice? So watch your email alerts in the next few weeks, and we'll probably issue some guidance on what it means to post this certificate. Another statutory change is required notifications to the patient's primary health care provider. This is new when it comes to administrations by medical prescription order. Protocol always required you to notify the primary health provider, but our rule on prescription order did not. So now this will force any pharmacist doing a vaccine by any method to notify the primary health care provider within 14 days. The 6 items there are exact ones that we have in our rule, so there's no change to that. I'm now going to talk about the general regulation requirements that apply to both types by protocol and by medical prescription order. First is Pharmacist Qualifications. You must have a current unrestricted license. That means you're not currently on probation. You must have a current CPR certification. You've received a certificate from a program training for administration training. Every year you're required to do 2 hours of CE related to administrations. You must file a notice of intent to the board. That was what I showed you earlier, and I'll talk more about that later on. And you must maintain the documents above for 2 years. The notice of intents are something you submit once a year telling the board that you're going to either administer by protocol or by medical prescription order. There are 2 separate notices. If you're doing both methods, you have to submit 2 different forms. And this is all done online now. We no longer accept paper notices. And what you do, you submit it electronically, and it will now show up on the licensee search. The location where you're providing the administration and the types, we used to ask that years ago. We no longer ask that, so there is no need to submit any kind of revision. Once you have submitted, it's good for a year. There's really no reason to do a revision. We do annually do an audit for those who have sent in the notice. It's random. The board will send out a letter asking you to produce these 3 documents here, and you just submit them, respond back with copies of those. Just a reminder, we're auditing for at the time you submitted the notice. So if you submitted it 9 months ago, that is the documents you need at that time. So the CPR certificate would be for 9 months ago. So if you were recertified since then, you need to make sure you're keeping your past CPR certificates. The rule actually requires you to keep them for 2 years. Another general requirement is delegation. The only person you can delegate an administration to is to an intern who also meets the requirements of having CPR, gone through a certificate program, and has copies of that. And the intern must be working under the direct supervision of a qualified pharmacist, and a qualified pharmacist would be one meeting the standards I said 2 slides before of all those. Additional general guidelines, you must be, as I mentioned, in accordance with CDC and manufacturer guidelines. Senate Bill 808 now has changed that. For vaccines, you must be staying within CDC guidelines. The regulation also requires you to be compliant with vaccine information statements and any kind of informed consent requirements. We're asked a lot when someone doesn't do something right, who's responsible? The pharmacist who's individually performing the administration could be held responsible. If it's occurring at a pharmacy, both the pharmacist in charge and the permit holder could be held responsible. I'm now going to split into the different types of regulations per type. First one we'll talk about is per protocol. And now the limitations, now has it been expanded, we've added the other vaccines, so now flu, pneumonia, shingles, and meningitis, and then the other 5 new ones, and then combinations of such are the ones you can be done by protocol here in Missouri. You're limited to doing only persons 12 years of age or older by protocol. The physician, you're required to have a physician be your protocol physician. They must be Missouri licensed, actively engaged in the practice, and no farther than 50 miles by road. People ask, how do we measure that? Well, we go to MapQuest or Google Map, plug in the pharmacy and the doctor's office address, and see if it says 50 miles or less. The physician is assuming responsibility and is responsible for oversight of the pharmacist on this protocol. Other general requirements is for the protocol itself, it must be written, signed and dated by the pharmacist and the physician, and both must keep a copy. A protocol is not valid for more than 1 year. A copy of the protocol must be kept for 8 years. And any amendments or revisions, all this applies to them. They must be written, signed, and dated, and everyone must keep a copy, and you must keep those for 8 years. Some specific requirements for a protocol, the identity signature of the pharmacist, the time period, what vaccines are going to be allowed, routes, anatomical sites, what patients are allowed, and the creation of a prescription. When you do administer per protocol, the pharmacy creates a prescription for each administration. The protocol has to cover handling of adverse reaction to needle sticks, the length of time to be observed, and the disposal of used and contaminated supplies. If you're attaching something to a protocol, a lot of times we'll see, they may say, see this policy, the protocol will say, see policy such and such on needle sticks. You must attach a copy of that policy to your protocol, and the physician must have a copy of that. So any kind of appendix, addendums that you attached referencing other things in your protocol, a copy must be available to the physician and also to the board inspector on inspection. Other requirements is the street address of the pharmacy or other locations. Other locations was added a few years ago when you're now allowed to go off-site. We'll talk more about that, but your protocol must identify those sites. You can always do an addendum to add sites, so if you want to do a clinic at a senior citizen center, you can always get your protocol physician, get it approved and signed an amendment and add another site. It needs to cover record keeping and notification requirements and have a termination clause. The record keeping requirements for vaccines by protocol, the prescription that's created must be kept for 5 years. You will have a separate administration record. It will be filed separate from the prescription filed. You must keep that for 2 years. We'll talk more about that in a future slide. Your protocol, as I said earlier, has to be kept for 8 years. You need to keep documentation of the notifications that you sent. And because this is a joint rule and the Board of Healing Arts has the identical rule in their regulations, Board of Healing Arts has access to pharmacy records. So if a Board of Healing Arts investigator came in and wanted to see records related to protocols, you would be obliged to give it to them. The prescription that you create, it's going to be authorized by the protocol physician. So the protocol physician is the prescriber. It's not the pharmacist giving the administration. It's the protocol physician. Our rule allows you 72 hours to get it on file in the pharmacy. People have asked, is it okay to have a scanned image of it? If you have a system that does scanning that meets our rule on scanning of hard copies, and yes, you can have a scan of it instead of a hard copy, but you must be in compliant with our rule. That's 2.083. The administration record that you're going to keep, the rule spells out it must have name, address, date of birth of the patient, the date, route, and anatomical site of the administration, the name, dose, manufacturer, lot number, and expiration date of the vaccine, the name and address of the patient's primary health care provider. And we understand, some patients do not have a primary health care provider. If they don't, we highly recommend that you write NA or none, something in that field instead of just leaving it blank. We assume that you didn't ask them if you left the fields blank. You must identify the responsible pharmacist. The rule doesn't say this, but I would recommend that you identify, if it's an intern that's doing it, that you identify the intern and the supervising pharmacist. And should you have any adverse reaction, it would be noted on the administration record. The rule requires that you send a notification to the protocol physician, also the primary health care provider, and to both of those anytime there's an adverse reaction. The regulation also requires that you follow any other state or federal notification requirements. At this time, I am not aware of any other state or federal notification requirements. And you must have documentation that the notifications were sent. The timeline for notification, the protocol physician is within 72 hours of the administration. The primary health care provider needs to be notified within 14 days. People ask, how can you do it? You can do it in writing. You can do it by fax. You can even do it in encrypted email and other methods. But you just need to document that you did it. The rule requires these items to be on a notification: the identity of the patient, the vaccine administered and the route, the anatomical site, the dose administered, and the date administered. Should you have an adverse reaction, you need to notify the protocol physician and the primary health care provider within 24 hours. We have come across pharmacies who've had adverse reactions, so it does happen, and you are required to report it to both providers. I'm now going to switch to medical prescription order, if you want to administer based off a prescription order. This one requires you to have a policy and procedure manual. It must be in writing and cover all aspects of the administration. It must be reviewed annually, so you need to document an annual review. And this is a separate document than the protocol. It may have very similar sections in it as your protocol, but it is a totally separate document. The rule just says cover all aspects. Here's a list of some that we would expect to see, which vaccines and drugs can be administered. And let me go back. Medical prescription order allows you to administer any drug. It's not just vaccines. So we have seen pharmacists do B12 shots, Depo-Provera, and other things besides vaccines. Should detail the routes, the screening process you're going to use, the administration process, the post-administration process, how you're going to comply with vaccine information statements, how you handle adverse reactions and needle sticks, how you're going to notify prescribers, and now, due to Senate Bill 808, how you notify primary care providers for the vaccines that you've given, how you're going to handle keeping an administration record, the prescription requirements, what a prescription has to have in order for you to use that as your authority to administer, proper disposal of your supplies. For record keeping, the prescription is going to be a 5-year record. Again, the administration record, it's going to be kept for 2 years separate from the prescription file. The prescription itself, some additional things besides what's required on any prescription. You must specify the vaccine or the drug and the dose to be administered, the route, if the date it's to be, or if there's a schedule, a listing of the schedule, and a statement that the vaccine or drug is to be administered by a pharmacist. This is a common deficiency we find. However, it's easily remedied. If you receive a Zostavax prescription and it doesn't say that and the patient wants it administered there, you can contact the prescriber and get authorization for that and just note it like a verbal clarification you would on a prescription, note it on the prescription. The administration record, similar to what we saw for the protocol, so I'm not going to go through that. The difference here would be if you're doing a drug instead of a vaccine, it would list that. The notification requirements our rule requires you to notify the prescriber. Senate Bill 808 will require you to notify the primary care provider for any vaccines that you give by medical prescription order. And again, an adverse reaction notification should you have one. Again, compliance with other state and federal laws, which I'm not aware of any. And again, document that it was sent. Again, this is one of the most common deficiencies, is no one documents that it was sent and who they sent it to. The notification for a medical prescription order has the same 6 things as with protocol. Again, Senate Bill 808 now requires you to send one to the PCP for a vaccine. For the prescriber, you must do it within 72 hours. And now with Senate Bill 808, if you have to do one to the primary care provider, it's within 14 days. Adverse reactions, similar to protocol, you have to notify the prescriber and you have to do it within 24 hours. I'm going to talk briefly now about off-site administration. This is allowing pharmacists to go outside of a pharmacy to provide administrations. This changed approximately, I think, 3 years ago. The statute changed to allow this. It can be done by protocol or by medical prescription order. Either one, you can go off-site and do that. And it now opens up the ability for you to go and be a part of a protocol not related to a pharmacy. An example would be you want to go help out at the public health clinic, and they have their own protocol with a physician there, no pharmacies involved. You would be able to get a protocol with the physician at that clinic, and there wouldn't be a pharmacy involved, but you'd be operating under how they do things there. But it is a totally separate protocol. The nurses at a clinic like that would have a different protocol than the pharmacist would. The offsite, if you're doing it by protocol, you must list the location in your protocol. As I mentioned earlier, if it's not in there, you can easily do this with an addendum to your protocol. And if you're not doing administrations by protocol on behalf of a pharmacy, so the example of the public health clinic, your protocol must list where the records are going to be kept, since they're not going to be kept in a pharmacy. So most likely they're going to be kept at the site where you're doing it, where the clinic is. So you need to make sure your protocol spells out where records would be located at. When the statute changed, the board also created a rule called a regulation called Non-Dispensing Activities, and it lists all the things that a pharmacist can do outside of a pharmacy. And there's an exemption here, and it allows for a pharmacist to go out and administer drugs and vaccines outside of a pharmacy. So there's an exemption to the non-dispensing rule. And then it allows for the use of technicians. This is the only time a technician can be used outside of a pharmacy, and the exception is to used at a site where vaccines are being administered. So if you had a clinic at a senior citizen center, you could take a technician to go along and help with paperwork and stuff like that, and do it. No other scenario is a technician allowed outside to be working outside of a pharmacy. And any technicians doing that must be under the direct supervision of a pharmacist. Going to go through some of the common deficiencies now that we see on inspection. Failure to produce a protocol or no protocol. Failure to produce, you usually just can't find the most current one. No protocol is they failed to renew a protocol, or they didn't understand they needed a protocol. Now that we're 5 years into that, we don't see that as much as we used to. Protocol not signed or dated by the pharmacist. This usually is an issue when there's multiple pharmacists signing a protocol, maybe pharmacists that don't regularly work at a location. Protocol includes vaccines not allowed. Now that we've expanded our list of vaccines, I don't think any of the border states have anything that allow more than we do. We used to see Illinois, I believe, allowed Tdap, and some of the pharmacists along the border got confused on what they couldn't give. So I don't think that will be much of a problem now that we've expanded our list. The protocol physician more than 50 miles away, we do run into questions about that. We usually have to refer those over to the Board of Healing Arts. Protocols missing some of the specific elements I talked about. Sometimes people get a protocol from somewhere else, and they need to make sure if you're borrowing someone else's protocol and you're going to use it at your own, that you read it and make sure that it has everything required in it, and it's what you make sure it details what you actually do in your practice. Failure to create a prescription within 72 hours. The prescription not in the protocol physician's name, that's been an issue. We haven't had that as much, but we'd see pharmacists actually putting their name as the physician in their records. No hard copy prescription. Again, you need a hard copy, but it can be a scanned if you're using a scanning system in your pharmacy that's compliant with our regulation. A hard copy not filed correctly. I found hard copies filed with the administration records in a separate folder. They should be in your regular prescription files. The administration record is missing one of the 6 things. Maybe it's just not filled in. A lot of times is the issue. The form has all 6, but no one's filling them in. The administration is not separate from the prescription, just the opposite of what I mentioned. We find these filed in the prescription file attached to the prescription. That's not where it should be. I've actually found pharmacy putting the sticker on the back of their administration record and filing that all away. They need to be separate and filed separately. Failure to send the notifications and failure to document it. All you need to do is document the date and who it was sent to. People have a variety of methods to do this. Some say the fax. Some write on the administration record that they did it, and then some of them are using electronic systems to do that, and they can pull the information up electronically. So there's a variety of ways you can document it. It's just when we come in, inspectors need to be able to see that you documented that you sent the notification. No policy and procedure manual for administering by prescription order. A lot of people think, I have a protocol that spells out everything I want to do. If I want to do Zostavax by prescription, I'll just follow what my protocol says. That is not correct. You have to have 2 separate documents. Policy and procedure not covering all the aspects of administration. Anything covered in your protocol probably should be in your policies and procedures. Failure to review your policy and procedure annually, or possibly just failure to document a review. A cover sheet at the beginning is a good idea, so you can document that you did the review. The review can be done by anybody that's responsible for it. It doesn't have to be the pharmacist in charge if they want to delegate another pharmacist. Probably best that the pharmacist in charge be involved in the policies and procedures, since they ultimately be held responsible for it. Prescriptions don't bear the statement that a pharmacist may administer the drug or vaccine. Again, this can be easily remedied if you get one, verbally call, and then add it to your prescription. Failure to keep a copy of your continuing education and CPR. This is an audit issue. When we do audits, some people, it's usually the CPR certificates. They don't have the current one, or they have the current one. They don't have the one from the time when they sent the notice in. Improper delegation. We have seen this happen. It usually is related to having some type of nurse in the pharmacy operating off a pharmacy protocol. A nurse would need her own protocol. If you are having a nurse in your pharmacy, there's more to it than just having a protocol. You might want to talk to your inspector to make sure you're doing that properly. Preparing syringes in advance. We've seen pharmacies who want to prepare them up, say maybe to go off-site, or just have them prepared because they're going to have an immunization day in their pharmacy and they want to have them prepared in advance. That's actually sterile compounding. That would have to be done in compliance with our sterile compounding rule and would require Class H. So most pharmacies wouldn't meet those requirements. So unless you're Class H, you should not be preparing syringes in advance. Some of the compliance resources we have out there on the board's website. We have a section dedicated to immunizations. We have a checklist I'll talk about. There's a frequently asked questions page. Your inspector is always a good source. If you have any question about if you need more guidance, you can always talk to your inspector. The Department of Health and Senior Services actually has an immunization website for providers. Here's the link to it. It's pretty informative and has links to other websites too. The board's website, on the left banner now, we have a section immunizations, and it gives you there. It also gives you the location where you can submit your notification of intent online. The checklist and the brochures, here's a picture of it. It's a two-sided checklist. One side's vaccines by protocol, the other is administrations by prescription, and it's just a checklist of everything you need to have. Does your notification have everything on it? And the 6 things there, you can check it. If you flip it over, it'll have the things for by prescription order. I will tell you this has not been updated since Senate Bill 808 became effective. So there are some things that aren't current on this. Hopefully we'll get it revised and up again. But the things I talked about today that were new from Senate Bill 808 are not on the checklist yet. Before we take questions, we got a little bit extra time. People always wonder what kind of investigations have we done with related to administrations. And I can tell you, since we've been doing this about 5 years, we've only had a few, and most of them relate to adverse reactions that have occurred. Some came via the FDA, some came from the public, some came, I believe one may have came from a prescriber or a primary care provider, but I believe all of them so far have been related to issues about adverse reactions. Unfortunately, when we go to investigate that, the pharmacy didn't always follow their policy or procedure or their protocol on handling an adverse reaction and notifying and that. So I would just advise you that you might want to review and have your staff review your section on adverse reactions and how you handle them. These are adverse reactions that happened after the fact. The patients came down with issues after leaving the pharmacy. This isn't a feigning adverse reaction. These are ones that sent them to a healthcare provider in the following days after an immunization. Okay, we're now ready for questions. If you would like to submit a question, go to your toolbar and type it up and hit send. Lisa's going to ask the questions and I will attempt to answer them.
Okay, our first question is, does this webinar count for the required CE related to immunizations?
Yes, it would. This is, the rule says that the CE must be related to immunizations, and we do consider this related to the laws related to immunizations. So yes, this would count for 1 hour. You need 2, so you need to go get another hour somewhere, but yes, you can use this. Okay.
Is a separate private room required to give immunizations?
The board does not have any type of requirement for that. We do have requirements, on confidentiality. I would highly recommend that it'd be nice to have it, but not all pharmacies have a separate room or a private room. I've seen people put up like the folding curtain type stuff to give some type of privacy. You still need to be worried about protecting the patient's medical information and confidentiality. So keep that in mind. Having them sit in a chair out in the front of the cash register probably isn't the best way to protect confidentiality. Okay.
Do all pharmacists have to sign protocol amendments?
The answer is yes. If you do an amendment, all the pharmacists need to sign it or it won't be effective for them.
And then how often do I have to submit a notice of intent?
That's an annual requirement. If you go online and do a licensee search, you will see, I believe it tells when you did it. So it'll be a year from that date when it would be due. So you can always keep track online and to see when they're due again. You can look at them for 11 months. After 11 months, they disappear. No? No. It won't pull up.
They can't. They're not allowed to do it for 11 months.
Okay. You can't submit another one for 11 months. Okay, now I understand. The system is now blocked. You cannot submit another one up until 11 months past your previous one.
Does an intern have to submit a notification of intent?
No, they do not.
What if a patient does not have a primary care provider?
I would, on your administration record, you're going to need to document that by putting NA or none. And it's not just by protocol. Now that you have to do one for vaccines by prescription, you need to know that. So you may need to revise, if you have a separate form for, now that's still a requirement on all forms. So no, I would just recommend NA or none and for that.
Does the board recommend any particular waiting time after a vaccine is given for a patient to be watched prior to leaving the premises?
The board has not. Since Senate Bill 808 came out, the board was asked, and the board's decision was to, it was up to the pharmacist's professional judgment on what that should be. I think if you do go online and do like at the Department of Health, look at some of those resources. 15 minutes seems to be the most standard that I see, but I don't, the board has never come out and said it needs to be that.
Is email a HIPAA compliant communication tool?
I cannot answer that. I do not know if it's encrypted. I would say more likely yes, but I cannot answer that. I would suggest talk to your legal counsel and ask them that question. Or if you're a large organization, ask your privacy officer.
Okay, here's a question about a nurse. We have a nurse on staff and have a separate protocol for her. Is this sufficient?
This, you really need to contact me or your inspector because there's more to it than just the protocol. It's how you're handling a prescription and how it's being done. So I really can't answer that without knowing more details. If you'd like to, the asker can contact me, and I will be happy to explain more about that.
Okay, we have a question about clarification about preparing syringes in advance, drawing up immunizations before you're going to administer them. Okay, and he further clarified, is that like if I have 6 people walking in once, can I draw 6 of them up? Yeah, if you're going to do it immediately to give them, yes. This is the example I was talking about is you're drawing them up to have on hand for future use a day later or later that day. But if 6 people come up and you know you're going to give 6 right then yes, you could draw those. But if you're preparing them in advance prior to anyone being there, just for a convenience factor, then no, we do not allow that. What precipitated the Senate bill? Were patients receiving multiple vaccinations or having safety issues? Okay, the history behind Senate Bill 808, the board was not the sponsor of this bill. So the board was not the one that initiated this. The board agreed with adding, the purpose of the bill originally was to add more vaccines to the list.
It is my understanding in order to get that done, whoever was trying to get this through had to add some other things to satisfy other entities, and this is how the other requirements got added. Again, I do not know. We were not involved in any of that. That is just my understanding of how those other requirements got on there. I will tell you the board at this meeting, which starts tomorrow, is going to talk about fixing the part about following CDC guidelines to allow it to be done by prescription order. So we're going to work on that.
Does the original immunization certificate ever expire?
If you're talking about your training certificate, no, it doesn't. We do not require, there's not a requirement to be retrained. So the answer is no, it does not expire.
Okay. Here's a question about when it is appropriate to give Tdap. Someone had told that we could not give Tdap if the patient had stepped on a nail. Is this true?
Well, I couldn't answer that. If you're basing it off a protocol, it would all be defined in your protocol who you could give Tdap to. So that would be something that need to be spelled out in your protocol.
And another question on wait time. If the pharmacist recommends the patient wait for 15 minutes after the administration of the vaccine and the patient does not comply, how should this be handled?
The regulation and the statute require that you advise them to wait. You can only advise them. If they leave on their own accord, that's nothing you can do about that. You might want to document that on the administration record just in case they go outside and they faint and crack their head in the parking lot. You can document that I told them to wait 15 minutes and they chose not to. Again, you might want to check with your legal counsel if you need further clarification on what you should be doing to handle that.
Can you use your CPR card as proof instead of a certificate?
When you're audited, I believe we do take the cards as long as they're in date for the time that was submitted. We do take cards, yes. Someone would like clarification on different types of immunization techniques that might come out in the future or have come out. They're talking about intradermal. You may not have been trained on intradermal when you first went through it. I don't know if I have an answer exactly on that, but I would hope you have some kind of training, documented training that you have either through the manufacturer or other on how to properly give one, but the board has not really ever addressed that, so that would be a good question to pose them in the future. Okay, we still have some time and we're almost out of questions, so if you have any questions, please send them in.
A pharmacist has been certified but has not completed the annual CE. Does the pharmacist have to catch up on past year's CE?
No, there's no requirement to make up past CE. You only need 2 hours of CE at the time you submit your notification of intent. You're attesting that you've done 2 hours in the last 12 months. So no, if you were certified and waited 10 years, you do not need to do 20 hours of CE related to administration.
Okay. Question on CPR training. Can the CPR be an online class or does it have to be live training?
No, the CPR has to have a live segment to it. I believe there are some that you do a home or an online thing, but then they also have live, but a true online only class would not suffice. And they are out there and they are offered, and the board would not accept that. Okay, if we don't have any other questions, I think we'll move on. We have not set the schedule yet for 2015. We're waiting for the board meeting dates to be set. Once they are, we will notify of the dates. So they're usually the day before or day after a board meeting. So watch your email alerts and we'll let you know when they're going to be. Again, I'll go over the CE requirements again. If you want CE, you must complete the webinar post survey. When I close the browser, I will tell everyone I'm ending the webinar. A little window will pop up on your screen and it'll say the webinar has ended. You need to click close on that. And then an online survey of 5 questions, I believe, it will open up. And then you answer those and submit those in. We have received reports that smartphones and tablets may not always receive the survey. If you do not get the survey, email us at compliance@pr.mo.gov and we will email you the questions and you can submit the answers by email. But you must submit them within 48 hours of the program. So CE certificates will be mailed in approximately 14 days. If you have any questions about anything, again, compliance@pr.mo.gov. Again, we do record this. We hope to have a link up on the board's website within 14 days. So I'm now going to get ready and close the webinar.